Insomnia is a common sleep disorder that affects millions of people worldwide. It is characterized by difficulty falling asleep, staying asleep, or waking up too early and not being able to get back to sleep. People with insomnia often feel tired during the day, which can impact their mood, energy, and overall quality of life. Insomnia can be short-term, lasting a few days or weeks, or chronic, persisting for months or even longer. The causes of insomnia are varied and can include stress, anxiety, medical conditions, medications, or lifestyle factors. Recognizing the symptoms is the first step toward understanding and managing this condition. Insomnia is generally classified into two main types: acute and chronic. Acute insomnia is usually brief and often occurs because of life circumstances, such as stress from a job loss or an upcoming exam. Chronic insomnia, on the other hand, happens at least 3 nights a week for 3 months or longer. Chronic insomnia may be linked to underlying medical or psychiatric conditions, or it may exist on its own. Understanding the type of insomnia you have is important for determining the best approach to treatment and management. The symptoms of insomnia go beyond just trouble sleeping at night. People with insomnia may experience fatigue, low energy, difficulty concentrating, mood disturbances, and decreased performance at work or school. Some may also feel irritable or anxious about their inability to sleep. These symptoms can have a significant impact on daily life and overall well-being. Recognizing these signs is crucial for seeking help and starting the journey toward better sleep. Insomnia can be triggered by a variety of factors. Stress and anxiety are among the most common causes, often related to work, relationships, or major life changes. Medical conditions such as chronic pain, asthma, or depression can also contribute to sleep difficulties. Certain medications, caffeine, alcohol, and irregular sleep schedules may play a role as well. Identifying the underlying cause is key to finding an effective solution. Certain groups of people are more likely to experience insomnia. Women, older adults, and people with mental health disorders such as depression or anxiety are at higher risk. Shift workers and those with irregular sleep schedules may also be more susceptible. Understanding these risk factors can help individuals take proactive steps to prevent or manage insomnia. Insomnia doesn't just affect sleep, it can have wide-ranging effects on daily life. People may struggle with memory, decision-making, and maintaining relationships. Chronic sleep deprivation can also increase the risk of accidents and injuries, especially when driving or operating machinery. Over time, untreated insomnia can contribute to serious health problems, including heart disease and diabetes. If you find that sleep problems are affecting your daily life or lasting for more than a few weeks, it may be time to seek help from a healthcare professional. Early intervention can prevent insomnia from becoming a chronic issue and help you regain control over your sleep and well-being. Don't hesitate to reach out if you're struggling with persistent sleep difficulties. Diagnosing insomnia typically begins with a thorough assessment by a healthcare provider. This involves discussing your sleep habits, daily routines, and any factors that may be contributing to your sleep difficulties. The provider may ask about your medical history, mental health, and any medications you are taking. This initial conversation helps to identify potential causes and determine the best next steps. One common tool used in diagnosing insomnia is the sleep diary. Patients are asked to record their sleep patterns, including when they go to bed, how long it takes to fall asleep, how often they wake up during the night, and when they wake up in the morning. This diary is usually kept for 1 to 2 weeks and provides valuable insights into sleep habits and potential triggers. A physical examination may be conducted to rule out medical conditions that could be causing insomnia. The healthcare provider may check for signs of chronic pain, breathing problems, or other health issues. Sometimes, blood tests are ordered to check for thyroid problems or other underlying conditions that can affect sleep. Healthcare providers may use standardized questionnaires to assess the severity and impact of insomnia. These questionnaires ask about sleep quality, daytime functioning, and emotional well-being. The results help guide diagnosis and treatment planning, ensuring that care is tailored to each individual's needs. In some cases, a sleep study called polysomnography may be recommended. This test is usually done in a sleep lab and records brainwaves, heart rate, breathing, and body movements during sleep. Polysomnography helps to rule out other sleep disorders, such as sleep apnea, that may be causing insomnia symptoms. Actigraphy is another tool used to assess sleep patterns. It involves wearing a small device, usually on the wrist, that tracks movement and activity levels over several days or weeks. This data helps to provide an objective measure of sleep and wake cycles, which can be useful in diagnosing insomnia. To be diagnosed with insomnia, certain criteria must be met. These include difficulty falling asleep, staying asleep, or waking up too early. occurring at least 3 nights per week for at least 3 months. The sleep disturbance must also cause significant distress or impairment in social, occupational, or other important areas of functioning. A key part of diagnosing insomnia is ruling out other sleep disorders, such as sleep apnea or restless legs syndrome. This may involve additional tests or referrals to sleep specialists. By excluding other conditions, healthcare providers can ensure that the treatment plan is focused and effective. Mental health plays a significant role in insomnia. Conditions like depression, anxiety, and post-traumatic stress disorder can contribute to sleep problems. During diagnosis, healthcare providers assess mental health status and may recommend additional support or therapy if needed. Lifestyle factors are closely examined during the diagnostic process. This includes evaluating caffeine and alcohol intake, exercise habits, and screen time before bed. Understanding these habits can help identify behaviors that may be contributing to insomnia and guide recommendations for change. Some medications can interfere with sleep. During diagnosis, healthcare providers review all current medications, including over-the-counter drugs and supplements. Adjustments may be made if a medication is found to be contributing to insomnia. The sleep environment is an important factor in diagnosing and managing insomnia. Healthcare providers may ask about bedroom conditions, such as noise, light, temperature, and comfort. Improving the sleep environment can often help alleviate symptoms of insomnia. Good sleep hygiene is essential for healthy sleep. This includes maintaining a consistent sleep schedule, avoiding caffeine late in the day, and creating a relaxing bedtime routine. During diagnosis, providers may discuss sleep hygiene practices and suggest improvements to support better sleep. Technology can both help and hinder sleep. Excessive screen time before bed can disrupt sleep patterns, while sleep tracking apps and devices can provide useful data. During diagnosis, providers may discuss the impact of technology and recommend strategies for healthy use. Family and social history can provide important clues in diagnosing insomnia. A family history of sleep disorders or mental health conditions may increase risk. Social factors, such as work, stress, or relationship issues, can also play a role. Providers often explore these areas to gain a complete picture. Differential diagnosis is the process of distinguishing insomnia from other conditions with similar symptoms. This may include depression, anxiety, or medical issues like thyroid disorders. Accurate diagnosis ensures that the right treatment is provided and that other serious conditions are not overlooked. Understanding whether insomnia is chronic or short-term is crucial for diagnosis and treatment. Chronic insomnia often requires a more comprehensive approach, including behavioral therapy and possibly medication. Short-term insomnia may resolve with lifestyle changes or stress management techniques. In complex cases, referral to a sleep specialist may be necessary. Sleep specialists have advanced training in diagnosing and treating sleep disorders. They can conduct specialized tests and offer expert guidance on managing insomnia and related conditions. Insomnia can affect people of all ages, including children. In children, insomnia may present as difficulty falling asleep, frequent night awakenings, or resistance to bedtime. Diagnosis in children often involves input from parents and teachers, as well as careful evaluation of routines and behaviors. Older adults are particularly vulnerable to insomnia due to changes in sleep patterns, medical conditions, and medications. Diagnosis in the elderly may require special consideration of age-related factors and a focus on maintaining overall health and independence. Women are more likely to experience insomnia, often due to hormonal changes related to menstruation, pregnancy, or menopause. Diagnosis may involve discussing these factors and considering their impact on sleep. Addressing hormonal influences can be an important part of treatment. Shift workers are at higher risk for insomnia due to irregular sleep schedules and disruptions to the body's natural circadian rhythm. Diagnosis may involve evaluating work patterns and recommending strategies to minimize sleep disruption, such as consistent sleep times and light exposure management. Cultural beliefs and practices can influence sleep habits and perceptions of insomnia. During diagnosis, providers may consider cultural factors that affect sleep, such as traditional remedies, family routines, or attitudes toward rest. Respecting these factors can improve communication and care. Substance use, including alcohol, caffeine, and recreational drugs, can contribute to insomnia. Diagnosis involves discussing substance use habits and their potential impact on sleep. Reducing or eliminating these substances may be recommended as part of treatment. It's important to distinguish insomnia from other sleep disorders, such as narcolepsy or parasomnias. Each condition has unique features and requires different diagnostic approaches. Accurate identification ensures that patients receive the most appropriate care. Partners or family members can provide valuable information during the diagnostic process. They may notice snoring, restlessness, or other behaviors that the person with insomnia is unaware of. Including partners in discussions can lead to a more accurate diagnosis and better support. Analyzing sleep patterns is a key part of diagnosing insomnia. This involves looking at when a person goes to bed, how long it takes to fall asleep, and how often they wake up during the night. Patterns of napping and daytime sleepiness are also considered to get a full picture. Diagnosis of insomnia relies on both subjective reports and objective data. Subjective data includes personal accounts of sleep difficulties, while objective data may come from sleep studies or actigraphy. Combining both types of information leads to a more accurate diagnosis. The Insomnia Severity Index, ISI, is a widely used questionnaire that helps measure the severity of insomnia. It asks about sleep patterns, satisfaction with sleep, and the impact of sleep problems on daily life. The ISI score helps guide treatment decisions and track progress over time. Stress is a major contributor to insomnia. During diagnosis, providers explore sources of stress and their impact on sleep. Stress management techniques, such as relaxation exercises or counseling, may be recommended as part of a comprehensive treatment plan. Sleep restriction therapy is a behavioral treatment for insomnia that involves limiting time in bed to match actual sleep time. This approach helps to consolidate sleep and improve sleep efficiency. Diagnosis may include assessing suitability for this therapy and providing guidance on its use. Cognitive behavioral therapy for insomnia, CBTI, is considered the gold standard treatment. It focuses on changing thoughts and behaviors that contribute to sleep problems. Diagnosis may include evaluating readiness for CBTI and connecting patients with trained therapists. Medications may be considered for short-term relief of insomnia symptoms, especially when other treatments are not effective. Diagnosis includes evaluating the risks and benefits of medication, as well as monitoring for side effects and dependence. Ongoing follow-up is important for managing insomnia. Providers may schedule regular check-ins to monitor progress, adjust treatment plans, and address any new concerns. Consistent monitoring helps ensure long-term success and improved sleep quality. Educating patients about insomnia and healthy sleep habits is a key part of diagnosis and treatment. Providers may offer resources, answer questions, and encourage active participation in care. Informed patients are more likely to achieve better outcomes. Tracking progress is essential for evaluating the effectiveness of insomnia treatment. This may involve repeating sleep diaries, questionnaires, or follow-up sleep studies. Regular tracking helps to identify what's working and what needs adjustment. Preventing relapse is an important part of long-term insomnia management. Providers may work with patients to develop strategies for maintaining healthy sleep habits and coping with stress. Early intervention at the first sign of trouble can help prevent insomnia from returning. In summary, insomnia is a complex sleep disorder that requires careful diagnosis and a personalized approach to treatment. By understanding the causes, symptoms, and diagnostic process, individuals can take proactive steps toward better sleep. If you or someone you know is struggling with insomnia, reaching out to a healthcare provider is the first step toward recovery and improved quality of life.